Hello and welcome to the topic Autoimmune Hepatitis in the module Gastroenterology and Hepatology. By the end of this topic, you should be able to define autoimmune hepatitis, explain the pathophysiology of autoimmune hepatitis, describe the clinical presentations of autoimmune hepatitis, outline the investigations in the diagnosis of autoimmune hepatitis, and finally discuss the management of autoimmune hepatitis. Let's get started. Autoimmune hepatitis can be defined as a chronic progressive inflammatory disease of the liver which has the tendency to develop into cirrhosis. It is characterized by the presence of circulating autoantibodies with high serum globulin concentration and inflammatory changes on liver histology. Autoimmune hepatitis has a strong HLA association which is towards HLA-DR3. The proposed pathogenesis of autoimmune hepatitis involves the combination of genetic predisposition and environmental triggers. There are three types of autoimmune hepatitis which have been characterized according to the types of circulating antibodies present. In type 1 autoimmune hepatitis, anti-nuclear antibodies or ANA and or anti-smooth muscle antibodies or SMA are present. This condition affects both adults and children. For type 2 autoimmune hepatitis, anti-liver or kidney microsomal type 1 antibodies, or also known as anti-LKM1, are found. This type usually affects children. And the third type, which is type 3, affects middle-aged adults, and this type produces soluble liver-kidney antigens. More than 60% of patients experience remission with steroids but relapse in 80%. Clinical features of autoimmune hepatitis widely vary. Most cases have an insidious onset. Patients may be asymptomatic or have non-specific symptoms such as fatigue, anorexia, weight loss, behavioral changes, and amenorrhea. Autoimmune hepatitis may present as acute hepatitis, chronic hepatitis, or well-established cirrhosis. Autoimmune hepatitis rarely presents as fulminant hepatic failure. Similar to the changes that take place following other causes of hepatitis, about a third of patients with autoimmune hepatitis present with symptoms of acute hepatitis marked by fever, hepatic tenderness, and jaundice. There are several laboratory tests that may be performed in cases of known or suspected hepatitis. These tests may fall into one or more of the following categories, which include general chemistry tests, which is to detect liver inflammation and or damage, screening tests to detect viral hepatitis, for example, exposure to hepatitis B or hepatitis C, tests to help diagnose other underlying causes of hepatitis, and tests to monitor the progression of liver damage or to help guide treatment. How about special investigations to consider in autoimmune hepatitis? Additional testing may be necessary to pinpoint the cause and help direct treatment. Some examples include acute hepatitis panel as well as autoimmune antibodies, as mentioned earlier, anti-nuclear antibody, anti-smooth muscle antibodies, antibodies against single-stranded DNA, and anti-LKM1 antibodies, which are associated with autoimmune hepatitis. Antibodies against single-stranded DNA or anti-ssDNA is seen in patients with type 1 autoimmune hepatitis. Antibodies to liver or kidney microsome type 1 antigen is a characteristic serological marker for the diagnosis of type 2 autoimmune hepatitis. And anti-LKM3 antibodies are positive in type 2 autoimmune hepatitis as well. Imaging studies may not provide a straightforward clue to the diagnosis of autoimmune hepatitis. However, an abdominal ultrasound or CT imaging may suggest the presence of active inflammation or necrosis. The appearance of an irregular nodule liver may confirm the presence of cirrhosis. Well, another important finding which can be picked up is focal liver lesion, which likely indicates hepatocellular carcinoma, a potential complication of autoimmune hepatitis. An additional test that can be also done to confirm the diagnosis of hepatitis or cirrhosis is liver biopsy, which then provides us histopathologic findings suggestive of hepatitis. Liver biopsy can be performed percutaneously with or without ultrasound guidance or by the transjugular route. The latter is preferred if the patient has coagulopathy or severe thrombocytopenia. It is one of the most important diagnostic procedure, in fact, in autoimmune hepatitis. So histologic findings on liver biopsy specimens are crucial. They help differentiate autoimmune hepatitis from chronic hepatitis C infection, alcohol-induced hepatitis, drug-induced liver disease, primary biliary cirrhosis, and primary sclerosing cholangitis. Autoimmune hepatitis is characterized by portal mononuclear cell infiltrate that invade the limiting plate surrounding the portal triad that permeates the surrounding lobule and beyond. Biopsies may also show evidence of interface hepatitis, which is an appearance of piecemeal necrosis, bridging necrosis, and fibrosis. Here, as mentioned, autoimmune hepatitis is characterized by a portal mononuclear cell infiltrate that invades the limiting plate surrounding the portal triad. There also might be plasma cell infiltrate, interface hepatitis, or also known as piecemeal necrosis, and lobular collapse, which is best identified by reticulin staining. For more than 3 decades, corticosteroids, either alone or in combination with azathioprine, have been the mainstay of drug therapy for patients with autoimmune hepatitis. Treatment must be individualized for patients with autoimmune hepatitis, as considerable variation in practice style exists when answering the following common clinical questions, which are: how high a dose of prednisolone should be used when initiating therapy? When should azathioprine be added to the patient's treatment regimen? When should a reduction in steroid dosing be considered? How long should treatment continue beyond biochemical remission? And should liver biopsy be performed in order to document histologic remission prior to attempting withdrawal of immunosuppression? These are the questions that should be answered, and the treatment can be individualized based on every patient's profile. Let's summarize. Autoimmune hepatitis is a chronic progressive inflammatory disease of the liver which has the tendency to develop into cirrhosis, and this happens due to circulating antibodies. So we have looked at the pathophysiology and causes, where autoimmune hepatitis can be classified into 3 different types based on the different autoantibodies that cause the different inflammation. Clinical manifestations depend on the stage of the disease. They may be asymptomatic in the initial stage or later stages become symptomatic. Investigations are aimed at diagnosing liver inflammation and its potential causes. And for management, steroids and azathioprine are prescribed, and those who have decompensated liver disease will require liver transplant. We have come to the end of this topic. Thank you.